Good afternoon, everyone, and welcome to Concurrent Session 7, which is about driving system reforms for better health and housing outcomes. So, my name is Julianne Burgess, and I'm the Chief Executive of the South Australian Housing Trust and the Facilitator for the discussion this afternoon, which is about driving system reforms, which will be an interesting conversation. So, we'd like to acknowledge that we're meeting on the traditional lands of the Noongar people, and also to acknowledge that we have people who have lived experience of housing vulnerability, and we appreciate people who are here who have experienced housing vulnerability and for your willingness to engage in these conversations with us. Today our speakers will give a short presentation, and then we'll move to a panel discussion following that. We thought it would be a good idea to give you some content about what each of the programs are delivering, and they're delivering across a range of jurisdictions and doing some quite innovative and interesting things. So once we've finished the presentations, we'll move to a panel discussion so that you've got an opportunity to ask questions. I think people are getting pretty used to that format now, so it should be something that people are well familiar with. So just as a background to the session, people with health and housing needs are less likely to receive efficient support because they require contact from multiple services. In Australia, the evidence shows existing programs that integrate health and housing improve consumer mental health and wellbeing and contribute to tenancy stability and generate cost savings for government. We know that partnerships between housing providers and providers in health, mental health and disability support can result in improved service quality and outcomes for the individuals who are at the centre of those experiences. The integration of health and housing systems aims to address the interconnectedness of homelessness and the individual's health and housing needs in order to improve those outcomes. Though integration at a programmatic level can be achieved, the scaling up of those integrations is a challenge. Separate national level agreements, policies and accountability mechanisms across many sectors means that competing goals, measures and lack of responsibility for cross-sector issues needs to be overcome. So some of the questions we're looking at trying to answer today, and these are big ones: how can health and housing services be better integrated to meet the needs of people with mental health, drug and alcohol issues? What positive outcomes have resulted from existing programs integrating health and housing? What are some of the key features of service delivery that improve the wellbeing of tenants with multiple needs? And what are the key challenges to systematic reforms for service integration and how these can be addressed? So, with those big questions on our agenda, I'd like to introduce today's presenters. You won't get a bio for them, you'll see that in your program, which you can look up. So we've got Deb Pratt, who's the Director of Mental Health and Wellbeing Reform for the Queensland Mental Health Commission. We have Famey Williams and Sharon McCullough from the Aboriginal Housing Office for New South Wales. And we have Renee Wirth from Homes New South Wales and Renee Lane from AHURI. And we're going to start with Deb.
Thanks, Julianne. Now, I think I've got to click on my face. Here we go. Okay. Thanks so much for having me here. It's great to be here in beautiful Perth. I'd like to begin by acknowledging the traditional owners of the lands that we're meeting on today, the Noongar people, and pay my respects to elders past, present and emerging. I'd also like to acknowledge any First Nations people in the room here today. Sorry, I'm getting a little feedback. I'll just step back. I'd also like to recognise any people in the room here with lived or living experience of mental health challenges, problematic AOD use, and also housing and homelessness distress. As Julianne said, we really appreciate the richness of conversation that comes from having lived and living experience, voices preferenced. I'd also like to acknowledge my Queensland colleagues, particularly from the Department of Housing and also from Q Shelter, who we've been working in partnership with. By way of introduction, my name's Deb Pratt, so I'm the Acting Executive Director at the Queensland Mental Health Commission. The Commission's an independent statutory body that drives system reform across Queensland's mental health, AOD, suicide prevention and related systems. Our role is to influence the systems that influence wellbeing. So we work to shape policy, build partnerships and drive change so people can live well, access the support they need and participate fully in society. Housing is a critical part of this picture, as we all know. So it's not just a roof over your head, but it's a foundation for recovery, healing and wellbeing. So we all know housing is more than shelter. It's about belonging, connection and the ability to contribute to community life. That message is at the heart of our supportive housing position statement, more than a roof, and I'll talk about that in a little bit. Everyone should have access to safe, secure and affordable housing that enables them to live well and contribute to their communities. It's one of the most pressing and complex challenges we face today, and unless we act, more people will experience distress. And yet, for too many people, finding and keeping a stable home is an enormous challenge, one that reflects the systemic barriers that continue to remain in our housing and support systems. As you know, it's nearly impossible to work towards healing and wellness when you don't have a safe place to live and the wraparound supports that you need. And this is where our focus must be. Here we go. Sorry. So you're probably well aware there's a complex two-way relationship between mental health, housing and homelessness. Poor mental and physical health can hinder a person's ability to manage the demands of daily life and maintain employment and sustain a tenancy. Mental ill health can lead to homelessness and vice versa. People experiencing homelessness often cycle through the healthcare system, presenting more frequently to emergency departments and having longer stays in hospitals and acute mental health units. Acute and emergency health services aren't set up to effectively respond to housing needs. Housing shortages are also placing pressure on the health system. The Australian Productivity Commission reported that approximately 30% of patients in mental health inpatient wards could be discharged if appropriate housing and community services were available. I'm from Queensland, and that means that on any given day in Queensland, there's approximately 700 people with a mental illness residing in hospital who could otherwise be supported in the community. For every person retained in a hospital bed who could be supported in the community, the health system is overspending. The average cost per patient day in this setting is $1,532, so that's more than $1 million a day. The personal cost of people languishing in hospital when they don't need to be there is also enormous, not to mention the impact on people who need hospital care but they can't get in because people who don't need to be there can't be discharged. Exiting institutional settings such as hospitals or prisons are critical transition points that can increase the risk of homelessness for people experiencing mental health AOD concerns. So people need safe, secure and affordable housing and supports that flex up and down as needed. People's needs are diverse and change over time, which is why we need a continuum of housing and supports. An effective housing and homelessness system goes hand in hand with access to high quality mental health treatment, care and support. Factors such as inadequate discharge planning, lack of coordination across sectors and limited housing places are complex challenges that require collective and consistent action to address. Our challenge is to bring health and housing systems together to deliver long-term sustainable change and connect people to housing with tailored mental health supports. There's no quick fix and no one-size-fits-all solution, and we all know that, unfortunately. But the good news is that we also know what works. So supportive housing is an evidence-based approach that combines secure and affordable housing with health and other support services. It's proven to be effective for people who have complex needs, including people who've been chronically homeless and people with mental health and AOD concerns. Supportive housing models demonstrate the critical importance of housing first approaches in ensuring that secure housing is provided prior to and isn't contingent on a person addressing their mental ill health or AOD concerns and is secure and affordable for as long as needed. Recent mental health inquiries have also highlighted that supportive housing reduces homelessness and interactions with the health system, increasing housing tenure, improving mental health and wellbeing, and promoting recovery, social connectedness and belonging. We've got many promising examples of supportive housing in action in Australia. And in Queensland, for example, we have Brisbane Common Ground, which is a 146-unit supportive housing complex that has successfully operated for 12 years. And I'd just like to acknowledge the Brisbane Common Ground and Common Ground Australia people at the conference. Evaluations of Brisbane Common Ground have shown its effectiveness in terms of positive tenant outcomes, tenancy sustainment and reduction in service use across health, justice and other social services. Too many S's, with associated cost savings, more S's. Housing first approaches in general have showed to a positive return on investment of between $1.44 and $1.80 for every $1 invested. So we know these approaches work and they provide benefits to people and system savings. And the question is, how do we scale these models and embed them as business as usual? Last year, the timing was right, and after a groundswell of inquiries and increased focus on the housing crisis, we brought together stakeholders from across government, non-government, people with lived and living experience, and peaks across mental health, AOD and housing to complement the work of others such as Q Shelter, Queensland Health and the Department of Housing, and to advocate for more supportive housing for Queenslanders with mental health and AOD concerns. We released More Than a Roof, our supportive housing position statement that calls for long-term stable housing with flexible supports for people with mental health and AOD issues and complex needs. In this position statement, we articulated a number of things we'd heard from our partners and stakeholders that we think will make a difference and improve outcome. So we defined supportive housing in the context of the needs of our cohort. We quantified the need for supportive housing in this group. And specifically, we used some modelling from 2013, which estimated that to provide adequate supported accommodation for people with severe and chronic mental illness, between 70 and 88 housing places per 100,000 of the population is required. And so therefore we estimated that upwards of 2,200 supportive housing places are required to meet demand in Queensland. We also made the case for why supportive housing is required, as I've already outlined, and we also provided some examples of supportive housing in action where the evidence is showing good outcomes, such as Brisbane Common Ground, as I've mentioned before, the former Housing and Support Program, HASP, in Queensland, Clear Breeze Apartments in Brisbane, the Haven model in Victoria, who I see are here at the conference, as well as other pathway models such as Youth Foyers, who are also here at the conference, and Brisbane Youth Service. We made 4 key recommendations for reform. So number 1, investing in supportive housing for people with mental health and AOD concerns. So leveraging the significant investment Queensland Government is already making in housing and noting the importance of supports to be side by side with that. And so leveraging the mental health levy, which is a payroll tax introduced in Queensland to provide a sustainable and dedicated funding source for mental health and AOD services in Queensland. And we suggested we need a specific target for people with mental health and AOD concerns. Number 2, enabling evidence-based and data-driven planning. So we're really supportive of the work that the Department of Housing has done to set the framework for supportive housing in Queensland, and we're keen for further investment for our cohort. That 2,200 supportive housing places I mentioned before is based on modelling from 2013, and a lot has changed in the environment since then. So we're funding... Oh, I'm getting the thing to stop. Shall I stop? I've got like a page. Can I keep going? 2 more recommendations, sorry. I timed this over and over and I got to 11 minutes, so sorry about that. Okay, so we're redoing that modelling work that was from 2013, just because so much has changed in the landscape since then. We're also investing in some capability work in terms of housing services and AOD supports. Number 3, we're focusing on strengthening shared leadership and cross-sector collaboration. We've been really pleased to see this concept elevated in Queensland with the establishment of the Homelessness Ministerial Advisory Committee, and the Commissioner is a member, the Mental Health Commissioner is a member of this committee and the Supportive Housing Subcommittee. And finally, number 4, we recommended improving transitions and exits and preventing exits into homelessness. And we're calling on implementation of the recommendation that the Australian Productivity Commission made to develop a consistent policy of no exits into homelessness from institutional settings for people living with mental ill health. So collective action obviously is needed to deliver better housing and support solutions. It truly is time to deliver, and if we can bring together housing and health, we'll create the conditions for people to live well, connect with the community and contribute fully to society. We really welcome your ideas, your evidence, your feedback. Yeah, please do come forward if you've got anything to contribute. Thanks for listening. Sorry I went over time. I'm really looking forward to hearing the other panel members. Thank you.
Just before you go, Deb, a question. Has your government accepted the recommendations?
Oh, that's a good question. We didn't formally submit it, via a cabinet process. We released it. We did a lot of work behind the scenes to garner support particularly from health and housing. We had tried to get some dedicated supportive housing places for this cohort. We couldn't get it across the line, but we live in hope and we continue to work with our health and our housing colleagues. I think we're all on the same page and aligned in our desires to do that, and we can see the benefits in it, but there's other priorities as well.
And it's the funding that comes with the acceptance of
Absolutely,
recommendations.
yes.
Fantastic. Thank you. If you join me in thanking Deb for that presentation. Next, I'd like to welcome, it's Famey and Sharon, yes, from the Aboriginal Housing Office of New South Wales.
All right. How do we get back to the face page? Escape. Oh no, hold on, it's not touched. There we go. Thank you. My name's Famey Williams. I'm a Gillable woman from northern New South Wales, and I just want to recognise the Wajak the lands and seas that we're lucky to be participating in this conference on today and yesterday, and thank them for the wonderful displays of culture that we saw yesterday. Want to pay my respects to its elders past and present, and introduce you to Sharon quickly, just to where you're from.
Hi, I'm Shaz McCullough. I'm a Wiradjuri Bundjalung woman from central western New South Wales, and have been delighted to manage the program we're about to present to you.
Thank you, Shaz. So I'm here as Chief Executive for the AHO, and as Shaz had said, she's our Program Manager for Services Our Way, but before that also a Place Manager, so has that experience of delivering this on the ground in the communities we operate in. For the AHO, yes, we are an asset owner, but we do try to look beyond the bricks and mortar and really try to think how we can challenge how government does business. We're lucky that we're not too big, we're not too small, and we've got a history of innovation that allows us to try new things and hopefully silence a bit of that sort of risk adverse, what do you call it, risk adverse?
Adverse.
Yes, the risk adverse behaviours you find in governments, which I think need to be broken down in order to actually get the results you want to see in your communities. I'm going to hand over to Shaz quickly. We're going to try and get through this at a very high level because we do have a video at the end.
Yes.
So if we don't touch on the points you want to, please come up to us afterwards. But I'm going to hand over to Shaz now to just talk about Services Our Way, the program.
Yeah, so Services Our Way actually began in what used to be Ageing, Disability and Home Care back in 2011, when that sort of transitioned over to the NDIA, Services Our Way transitioned over to the AHO. So we rolled out there in 2017, but the remit broadened to any Aboriginal person living in a vulnerable situation or that needed some case coordination. Currently we have 34 local government areas covered with Services Our Way, with 6 sites across the state. We have 38, I think now, Aboriginal case support specialists we are all 100% Aboriginal staffed. So the program is actually built around practical supports to personalised support plans and put the person at the centre of the plan to create goals and to try and reach those goals. There's really no time frame put on it, and there's no age group. We actually are supporting in the last financial year 849 families, which exceeded our target by 111. Yeah, so evaluation that we've recently gone through in 2024 was commissioned just to see what, the program that was intended to roll out was reaching the desired achievements that it was trying to hit.
Oh, hold on. Right there. There we go.
So the mixed method of evaluation that we did go through was run by the Centre for Evidence, CI and Implementation in partnership with Corujo at Monash University. But some of these things you see on here were the way that some of the evaluation processes took our clients and our team through. But I'll hand over to you, Famey, so you can give out that high-level information.
So the key things for us that came out of the evaluation, and I'll probably highlight a couple of things, they're not on here, but the key points were that we don't just look at housing. Majority of the referrals are for housing, but once we have people on board, we find that the core reason where they're finding challenges usually to do with mental health or other health barriers, amongst other things. And what is important with Services Our Way is that it does take that sort of holistic look at the person. So we don't predetermine what kind of service somebody will receive. With it being Services Our Way, it is really around what's best for this individual and their family. So it's not anything that's contained to the person that is referred. It could be something that extends also to their partner or their children. 5 minutes, okay. Oh, God. All right, so look, key things. I'm just going to hit a couple of key outcomes from the evaluation. For every dollar that we spend, we get, I think it's $1.46 return on that dollar. So why I make that point is because for every Services Our Way client, the cost is about $51 per person, and that may seem quite a lot, but I think it speaks to a lot of the challenges with many of programs in our community is that you need upfront investment because you're working with people that are already behind the 8 ball and having vulnerability on top of vulnerability. You need to have comfort in putting a lot of investment up front if you want to see that sustained. And it's something that we want to see in future evaluations is how people have progressed outside of Services Our Way and whether they've been able to retain that capacity. One thing that we have seen is that 97% of clients who completed the survey were satisfied, which is really great for us. 83% of clients who had self-identified their goals, which is an important part of the program, they exited the program achieving those goals. And we had a number of recommendations that came out of the evaluation, which we are working on now. One thing we do want to see in the future with Services Our Way is it is a government service. So we want to actually see how this can be delivered in our Aboriginal community controlled sector. It's something that we have asked about. We have put a bid up for in the past. We haven't been successful yet, but we'll keep trying because, it is a long game. So we are hoping that we're able to expand this service into non-government service delivery in the future. We do have demand that outstrips our resources immensely. And we're happy after this to take any further questions, but we wanted to quickly go through the slide because we wanted to actually share a small video. Yesterday with the youth, there was a session in the room here yesterday where we had a number of young people with lived experience, and I think that really drove home the programs that they were there to represent. And this is a video, it's not good quality, of one of our community members talking around what the program has meant for them. And what it does, it really highlights the complexity of all our services and the barriers it presents for people that are just trying to access them. So I'm just going to play this quickly. 2 minutes.
Hello, my name is Pratt. I'm here today to share with you my personal journey with Services Our Way. Even though I will not get to share the whole story, I want to share the most important part, which I could only dream and think about during the 20 years I've spent in jail. While I was sitting in a cell and thinking how my life could be when I got out, I never would have imagined it to be where I am today. I knew there would be a lot of challenges and throughout each situation, but I never thought about the years that had passed and how much the world has changed in that time, especially my children. When I was in jail, I didn't sit there in silence, reliving my bad childhood. I didn't sit there in silence and think about how bad things would get, that I would get on the grog to numb the feeling and memories. How getting on the grog then led me down a troubled path. All I could think about was being reunited with my own family. When I was finally paroled, I had no one I could be paroled to, so I was released into a temporary integration centre. Although I was free, I couldn't be with my family because I didn't have any ID, Medicare card, and most importantly, a home. I had nothing and no one. One of the conditions of living in temporary accommodation was I had to complete from 3 to 7 tenancy applications a week and then make it to each of the housing inspections to review the properties. I was trying to meet these conditions even though I didn't have a computer, didn't know how to use one, and didn't have a smartphone or any clue how to use one. If I did, I didn't have a car or hope that any private landlord would rent to someone with a criminal record. It was doing me head in. It felt like simple things for everyone else were a struggle for me. I felt like there was no way out. I felt like, what's the point? After my first week of being free, I told my parole officer I wanted off the merry-go-round and to be sent back to jail. I know how bad jail is, but at least I thought I would have a roof over my head and a meal. My parole officer then told me about Services Our Way. I met a Panya from Services Our Way and told her that all I wanted was to be reunited with my family, but I didn't know how. Panya gave me my hope back because she had connections with DCJ and other services to help locate my lost public housing application. She took me to Services New South Wales and stayed with me for hours. It took me to get my ID. She filled out 40 tenancy agreement applications for private real estate, submitted 35 evidence and supporting documents to DCJ for me to be assessed as priority for my daughter and I. She advocated for me until I got a home. She picked me up from hospital at 6:30 p.m. at night after my cancer surgery because there was no one else I could be discharged to. Nothing was too much trouble for a Panya. Over the course of 456 days, every visit I made to a Panya, she made me feel like I was a person, not a nuisance. It was not worth the trouble because I was only going to go back to jail. Unlike others, the Panya supported rather than judged me. She knew how much I wanted to be with my children, and I was prepared to do anything to be with them. Today I have the roof over my head that I share with one of my daughters who has a mental health condition. My other daughter has just graduated from the iProud Academy, and I get to see and spend time with my grandchildren. I have completed cabinet making and joinery trade certificates and cert-free in laundry operations. Things still aren't easy, but now I can be the father I want to be for my family. I'm there for them and give the support they need to get through difficult times. I knew I wanted a better life for me and my family. Now, because of the pain, I have it. I wanted to be here today because it's my way of giving back to Apanya for all that she has given to me. Thank you all for listening to my story.
So I just wanted to share that because it's a good show of what the work Shaz and her team do.
Thank you so much for sharing that.
I wasn't looking at the stop sign. I'm
There are such powerful stories when we can hear about lived experience, and certainly how programs can impact individuals and make a huge difference in people's lives. So now I'd like to invite conveniently named Renee and Renee. I'm not sure who's going first, but Renee's going first. Yep.
Thanks. Okay. Right, hi everyone. Thanks Julianne. So I would like to acknowledge the Whadjuk and Noongar people as the traditional custodians of the lands that we're so privileged to meet on today for our conference, and pay my respects to elders past, present and emerging. But I also wanted to reflect on something that Dr. Elizabeth Hayden said in her beautiful Welcome to Country yesterday. And she had a call for us conference goers to have courageous conversations. And we've seen so much of that in the past day and a half, and I feel like we've really continued that today with this session as well. So just to give you a little bit of background, so our professional services team at AHURI were engaged by the New South Wales Department of Communities and Justice to develop this exploratory paper that would help inform their Housing First approach for their new strategy and vision for homelessness. So I'm just going to give you, hopefully, a brief high-level background of this paper. Feel free, if you have any questions, to come to the professional services booth in the afternoon tea to ask any more questions. And then I'll pass you over to the lovely other Renee to talk about how it's informed their new approach. So this paper draws on 4 broad different sources of information. I won't bore you with all the academic details, but I would like to acknowledge the input we had from various stakeholders that we engaged with. So experts from the community housing sector, various service providers across different sectors, academics and New South Wales Government Department representatives, and also the lovely members from the street care team who so generously shared their lived expertise to help inform all of this work as well. So what this paper really does is consider, how do you embed Housing First into the New South Wales homelessness service system? To get to the punchline straight away, you embed Housing First in a much kind of broader and different way than what we usually think about it, and you embed it beyond the homelessness service system. So the paper firstly outlines these different approaches. I like to think of them as layers of implementing Housing First. So we know Housing First features quite heavily in government responses to homelessness now, but it predominantly exists as a programmatic approach. So in New South Wales, that's programs like the Together Home program. And this is where you have a set of Housing First principles that are embedded into a program model. Traditionally, that serves people experiencing chronic homelessness, but more recently, we've seen really great innovations around that program model to be tailored to other groups such as families, youth, and First Nations people. The second, layer of looking at Housing First and how you can implement it is a singular system approach. So this is where you bring those various Housing First programs in an area, and they might coordinate into a system at the local level, and this is where they might have centralised intake, data management and infrastructure processes. They might even work off this kind of same list of housing. And these methods of implementation, we know they can be effective in facilitating housing stability and increasing access to services as well. But what they don't do, and they're just simply not designed to do, is assist in ending homelessness, reaching the concept of functional zero, which is basically just a really conceptual way of saying a system has capacity to respond to homelessness. And I say this because a lot of the kind of new visions that governments are coming up with and working towards is that homelessness is rare, brief and non-recurring, which is again that just concept that we have capacity to respond. And so programs can't end homelessness because they're too narrow in their target group. They don't do anything in the way of secondary prevention, so looking at those who are at risk as well. And they also rely on sufficient housing and service supports in the system to even function in the way that they're meant to. And so truly shifting towards a system and vision that homelessness is rare, brief and non-recurring requires broad system reform. And so that's where we have that whole of system approach at the bottom as well. So this is where we extend beyond the homelessness sector and include other public sectors who also then reorganise their service delivery and policy coordination, and they integrate around some higher level principles of housing first. We see this in operation in Finland, but of course we're in a very different context here and we need to think about how it's going to work in New South Wales and in Australia. And so up on the slide here, we have proposed a working definition just to guide the planning and design of the approach for New South Wales. Those bolded parts really just capture the core components of the housing first philosophy, and they also align with that vision of system reform set out for the new strategy. But applying this whole of system approach has three key considerations to make it work. That definition there really needs to be refined and socialised with the sector, who need to understand how their existing programs and policies do and don't align with that approach, and they need to have a shared understanding of what Housing First as a whole of system approach is for them. The second one, which maybe should have been first, is cross-sector integration. So we know homelessness is driven by and intersects with a range of issues in the remit of different sectors. So we need buy-in and we need responsibility to align with this approach. And the third one, which we've heard in probably all of the sessions, is housing as a human right. So I'm not going to go through these four things in detail, but we identified these key four elements for shifting towards the whole of system housing first approach in New South Wales. None of these are new ideas, but the paper goes into a lot more detail than this in terms of opportunities, risks and implications across these four areas and for different groups. Available online to read again, but for now I will pass you over to the lovely Renee, who can speak about how it's informed the new strategy.
Thanks so much, Renee. Makes it very easy. Just want to acknowledge the work of the AHURI team in putting together the piece of research, and also a plug for the professional services team. We've had long-standing partnership with AHURI around a range of different research projects to inform our housing system and reform. So it's not the first time we've worked with AHURI, so definitely if you haven't done it before, go and see them. And certainly I'll say this so I can get invited back to another conference. So thank you very much, Renee and the AHURI team, for the piece of work. Do encourage you to have a look at it. It is a really interesting piece of work. It's on both our website and on the AHURI website. If you Google it, it'll come up straight away. So as Renee said, we commissioned the piece of work as one of the pieces of evidence to inform a new homelessness strategy for New South Wales. So in August this year, we released a whole of government strategy, a 10-year strategy that has a really wide and broad reform agenda, and it is a big reform agenda for us, given where we are currently. Just also acknowledge Tams and Knight in our from our homelessness strategy team, who spent 2 years working this through with a whole range of government agencies. So for the first time, it's a whole of government homelessness strategy. Homes New South Wales and the Department of Community and Justice is the lead, but it does reflect a commitment to a different way of working and a reform agenda that is around rare, brief and not repeated. So we are very much aligning with what is considered best practice, but it is a huge shift for us to get there. I don't think, as we've moved into we've got it released, we're very happy, it looks fantastic, it's been well received. As we move into how do we actually implement this, there are many elements we're already implementing, but how do we really push forward? Because 10 years is, it comes around quickly, and really we need to get moving in a lot of things that we need to do, because we are in a very, very significant housing and homelessness crisis in New South Wales. So the key thing when we think about the research from AHURI and also our own experience implementing Housing First work is how do we actually apply it as a system approach. We have had some really good success in a programmatic sense. We know housing and support works. That's basically the response that we need. But how do we actually move away from our crisis and transitional supported housing programs into a systemic response using long-term housing, probably primarily social housing, and this long-term support that's needed? That's not how our system is currently structured. We separate out the supported housing models from the long-term housing models, and we sort of scrape around to get the support someone who lives in long-term housing and social housing needs. So we haven't had flexible support packages focused in this space outside of the Together Home program, which we implemented as a COVID response. So how do we take some of the principles of Housing First and acknowledge in a constrained system like New South Wales with significant demand that we won't be able to deliver this sort of approach for all people experiencing homelessness? We will have to focus and target it to those who are experiencing chronic homelessness and those with multiple needs, including those with significant mental health issues. So how do we move away from that crisis-driven response to be person-centred, to ensure that we use the housing as the foundation and have the partnerships and the connections to deliver the support we need? And also, in the challenges that we know exist for people who are managing complex and multiple needs. Once they're housed, how do they actually have the support to sustain it over the long term, and we stop that cycle of chronic homelessness? So we've got a lot of challenges, but we do have some opportunities as well, which is good, because there is a real commitment across the service system, across New South Wales government agencies and our key partners, community housing providers and the specialist homelessness service system, to move and shift towards the goals of our homelessness strategy. So we do have a commitment in New South Wales to an increased social housing supply. We are using other funding sources to increase our crisis accommodation responses. But the key challenge is probably the access to the right support funding and how you actually design a flexible model of support that can be person-centred, but also sustainably delivered by our key partners, the SHS service system. So these are things that we don't currently have in place in a systemic way. So we really do need to work with all our partners to make that happen. So there are some things that are really key that we can do better, and that is reduce the coordination waste that we have across the service system. So how do we coordinate with our key partners between housing, homelessness and health providers really clearly, and be really clear about how we are prioritising our housing and allocating it in a rapid rehousing response for the people in need, who also then need access to the ongoing support packages. So we do need to use a whole range of tools to embed this across the service system and really move away from programmatic responses. What are our tools? How do we work it through the service system, including into our commissioning approach, our coordination and local partnerships approach, and particularly for the agency that I work for, like stepping back into being a system steward. So being there to support and assist and drive the reform with our service partners. And we also need to make some different decisions about how we fund programs. We have a number of programs that sit outside our specialist homelessness service system, and moving away from that and redirecting that into flexible support packages is going to be key. But that takes time, and it means there'll be winners and losers in that space as we move away from program-based funding approaches. So the first thing we're doing, or Tamsin's doing, is a Housing First framework for New South Wales. There is lots of... Oh, stop. I'll just go for a bit longer. So we're just doing a Housing First framework for New South Wales. We are rolling out a much more structured local collaboration framework. So actually lots of meetings happen across the service system, but we want to have a much more structured, coordinated way in doing that. So they're probably the two key things, and shifting our funding. I'm stopping now. Thank you very much.
Thank you so much, Renee and Renee. And one of the things that I think is a real challenge in this particular space is how you get your partner agencies to work with you. So I'm curious about how you've managed to do that specifically in New South Wales homes. You're probably sitting up.
Yeah, look, that's a really great question. I think I've been working in the housing and homelessness industry in New South Wales for over 25 years, and I think it's the best we've seen the relationships and partnerships, particularly with mental health. We've always had a long-standing agreement and governance structures that sit around it, but I think we've got some different tools and roles within the service system that mean we are much more coordinated, at least at a housing and mental health level. We also have our minister, who's the Minister for Mental Health and Homelessness and Housing. That does help drive some of that stuff. We do have a lot to do, though. We have a huge amount to do. We can have governance. We have a number of governance structures already in place, but really we also need to, as I said before, reform how we work at a local level and make sure when we have meetings and coordination groups, people are coming to make decisions. And it's not just an information sharing space, and that's, I think we need a tighter practice around that. So being really, really clear the role of service system coordination at a kind of a broader level at a local district, and how we actually then at a care coordination at an individual level work to rapidly rehouse and support someone. So we are also working in partnership with a service system around, rolling out more broadly like a by name list, I know, which is being used in other jurisdictions, and we have it in some locations, but using all the tools we have available and really making sure that we're not using existing governance frameworks just to share information, but we are driving the conversations, the hard conversations around escalating issues, and making sure at a district and local level we're accountable for those partnerships working well. I mean, the challenge is always going to be, and I think the service system feels this, is that there's just not enough housing and support. So there's always a lot of advocacy, but we really need to kind of get together and be clear that we have to prioritise the resources that we have. So I don't think we've got the final solution, but I do think we've got a lot of people heading in the right direction, and we are wanting to have the conversations around making the systems and governance that we have work best.
And so, Deb, this is often mental health that gets the flogging from the housing sector to say if only we had better mental health supports, the system would work much better for tenants. This must be a refrain that you've heard a lot.
Yes.
And your response to that?
But vice versa as well. I think we hear it on both sides. We hear housing saying there needs to be more mental health services saying these aren't actually our clients, they need housing support. So I think if we can get both parts of the system to shift or expand out who they will work with a bit more, we could really make a difference for people. I think, as we're in a more constrained environment, everybody just narrows in on the people in the most need. And I think that I can understand completely why that happens, but I think it's so short-sighted as well. We really need to shift upstream more. We need to have health services that are more available to more people to stop things escalating, and we need housing services that are more open to people as well. But the reasons why it's not like that is obviously very complex, and I think we're all trying to work on that. So I think the bottom line is that everybody wants a better system, but we are all the system. So what role do we all play in trying to shift that? It's really challenging. I don't have the answers.
Thank you very much. And so from an Aboriginal housing perspective, one of the challenges I suspect for you and your team is finding culturally appropriate services that you can work with, or services that have people within them that can provide culturally appropriate supports. How important is that for you?
For us, it's integral. I don't think you can have a successful service without that. And if I use Services Our Way as an example, making sure that we employ people that are from community and that they understand the service network and they have established relationships, because we don't employ people to be caseworkers, but they're more facilitators, because we recognise the barriers are there. They're not something we're going to be able to overcome immediately, but there are people that are going to sort of navigate and help people guide through the myriad of different doors and, fences people have to jump to try to get the service that they need. So for us, having Aboriginal staff is a non-negotiable, because they understand the challenges. They also have the experience themselves of navigating that, or their family navigating it. So having that lived experience is a really big factor for us. And, we're going to encounter services that don't have that cultural appropriateness, but having our staff act as facilitators, they can kind of remove the clients, such as like Brett, from that additional trauma. They help navigate that a little bit better. So for us, it's really, and it's something we want to see more of, is how do we actually get this more into our ACOs, so Aboriginal Community Controlled Organisations. That's something we hear often in our experience in New South Wales, is people are saying people are still coming to us even though other services are funded for it. So how can we be supported to work better with your services? So that's something that, with our colleagues in homes, is how do we actually do that better into the future around that sort of holistic tenancy support. I say tenancy loosely just because it's a housing thing, but it doesn't necessarily mean people that are in tenancies either.
And there's no question that sticking all of the parts of the system together is one of the most difficult things we do on a daily basis. So I'm going to open up the floor to questions. So we've got 2 roving mics that are in the audience. So if anyone's got a question. There's one down here.
Hello, good afternoon. Good afternoon. It's not so much of a question. First of all, I'd like to thank the panel, all of you, and facilitated so well. I am like Renee Wirth. She said she's worked in the sector 25 years, me probably 40 years. For the first time, New South Wales actually nailed it. It needed to be a whole of government. And then the next principle, number 1, is right space. Now, you all know the Residential Care Act is now going to be right space. So everybody is following this right space. So even 40 years ago, we talked about human rights. So now we are witnessing, we are convincing people. So what I want to ask you guys is, I think I'm seeing the need for collective leadership, not individual single stars in any other department or branches. Is how do we promote this collective leadership for collective impact? Thank you.
Great question, thank you. I'm going to go first to Deb.
Totally agree. It seems like a no-brainer, doesn't it? But it's just so hard to do. I think that we need leaders to decide that it's a priority and then put everything into actioning this. And I think
we need, and I think I'm speaking to the converted. We need to recognise that this is something that crosses all portfolios. It's so great to hear that New South Wales is doing a system-wide approach there. I think there's a role for central agencies in government as well, so Department of Premier and Cabinet and Treasury, to drive some of that leadership and accountability as well. It's really easy for things to get lost when there's so many different priorities, but I think if you've got some of that central agency driving that, deciding that it's a priority, that helps. But I think the challenge also is that these are issues that will be resolved over decades and beyond political cycles. So, how to move it from the bright, shiny thing of the problem of the people on the streets that we all see as we walk past to, again, shifting upstream to thinking about what are the drivers of homelessness or housing instability in the first place, and to have an invest to save mindset as well, to see that this isn't a problem to be solved, but it's an investment in our future communities and productivity and the people in our society. And I think that's where that human rights focus comes in as well.
So Renee, how do you do that when you've got many, many competing priorities that land on your desk every day? How do you prioritise the work of working with other leaders?
That's a very good question. I mean, I think in many ways the leaders that we work with in New South Wales in the housing system and the homelessness system, we're very aligned and have the shared outcomes. But things change and shift, and we can't rely on individual personalities. And when we've seen things really, really work at a local level, it's been someone who's got a great deal of charisma and charm who can bring people together. But when that person leaves, how does that continue? So that is a question for us when we look at local collaboration networks, is how do we rely and embed it as a system and train a whole range of people to work in a collective way that's not reliant on one person. That's at a local level, but at a more like a broader level, when you're looking at the kind of whole of government and my sort of counterparts in other agencies, I have been spending a lot of time thinking about influencing styles, and we do have our friends in Treasury and the Cabinet Office out on a little tour today in New South Wales, trying to understand what is support and how does that matter. So we're trying to use a whole range of ways to think and influence people who aren't necessarily deep in the housing and homelessness space to understand what we're talking about when we talk about system change and investment. So we've got them out saying some of our interesting temporary accommodation, and also looking at some good crisis accommodation, some of the challenges. So yeah, we're spending a lot of time thinking about how, and acting, and moving something away from being a very nice looking piece of paper into the change management sense. So it's, there's a lot to think about. There's 24 hours in a day, and I spend a lot of the time thinking about how do we move and shift things. But there's a lot of people wanting to do it because we know that we actually know the direction to head in. We know housing and support works. We know that we need to really focus and work together. But there's a lot to do.
And Famey and Sharon, how do you maintain the energy it must take to just keep engaging with large agencies in a way that's not always productive?
I was just smiling because when Renee was talking about, having Treasury out in the field, our Brett, that presentation that we did was to Treasury. So we're trying to target our efforts into showcasing where our clients can go, our tenants can go when they've got that support. So, sorry, I just deflected from that, Famey.
No, that's important. I was going to make that point too. So it's good. It's how do we draw the connection for people that are in the spaces that are making the decisions around what funding we get and what we don't get, and how do we draw the line to the person on the ground who's receiving the service at the end and the outcomes we want to see. And for us as an agency, we are within government, and with that comes all the baggage that is there. It's not going anywhere anytime soon, even though we're an Aboriginal focused agency. It's something that we're very conscious of, and we were talking about this in one of our staff conversations the other day, and it's like, well, we don't have the luxury of holding grudges or being bitter. You don't have that luxury of going, they're pissing me off, I'm not going to talk to them anymore. You may want to do that, but you don't have the luxury. You're here paid off the back of people that are suffering, so you need to get over it. And you need to keep turning up. And if you don't want to do that, then don't work here. So it's really, that's not, great. But I think also it's like a very human response is like making sure we employ people that think that way, because we all support each other with the necessary humour and sort of lifting each other up, and build people that are very eager to build relationships based on that dignity and empathy and trying to cut through all the BS. Yeah.
Well done, thank you. Please take your pick, whoever you can get a microphone to.
Questions.
That lady at the back there. Thank you for picking me. I'm Sophie from the City of Melbourne. Really valued the presentation today. I'm really interested in this in terms of kind of higher density and mixed tenure developments, and particularly the first year of those developments, we see a lot of kind of issues in establishment in large social housing projects, and that's also when there's the greatest scrutiny on them from people who may have already held like biased views of social housing, and this can reinforce those views and kind of undermine the broader cause. So I'm interested in the panel's thoughts around like the first kind of 12 months of a new project in particular, and kind of having really good supports in place for tenants as they settle in a new home and settle into a new neighbourhood.
Famey, do you want to go first?
Oh, look, we don't have a lot of higher density. It's something that we want to move into. But when we do look at supporting, I'll maybe deflect to Shaz around the services our way. But for us, it is making sure that we are looking at the community as a whole and understanding that we're trying to build in places where we know people have the right supports and that there are the services there that can support them. So when we are looking at new areas, we do make sure that that's driven by the data that we have and the relationships that we have on the ground to inform, are we doing this in the right place? So that way we know we're placing people where they're going to have the most success. But it doesn't mean we get it right all the time. I've had those conversations. We've got a tenant right now who's constantly coming up to me because local members saying we want them gone, they're causing a lot of problems in the neighbourhood, and for us it is that constant advocacy to say, look, we recognise that, but we're not going to make a home with children we're not going to boot them out. That is the priority for us, and it's really just working with services on the ground to understand that we're connecting them with, our local Aboriginal community housing provider. We're supporting them to navigate those channels with local police, local members and things like that. So it is a real case-by-case thing for us in making sure that we support, because we don't do the management ourselves, our providers do. So when we have an Aboriginal community housing provider, that we try to think, okay, how can we use our leverage to try to help them navigate those sort of thorny issues that happen on the ground that often result in people getting, pressured, people putting in a lot of complaints and wanting to boot them out. Is there anything you wanted to...
I think from our service view that we provide, it's more around connection and connecting people to the right supports. And if they don't have those supports in place and they're just moving into a new property, or they're just moving into a new neighbourhood, if we don't have those connections made for those people, it could set them up to fail in that particular community. We've had a lot of, families had to relocate for one reason or another, from, metro to country and vice versa, out to regions. Very, very hard for them to start again. But if we put those supports and connections in place to provide that tenancy support, connect with schools, connect with even employment agencies, men's groups, women's groups. We find that they settle a lot quicker and integrate into that community a lot faster than what they normally would.
I might say something. It is a challenge. Big, large sites of a social housing are very difficult to manage. They are, but then in a city like Sydney and high, value locations, we have to make trade-offs. We already have a lot of high-density housing in our city of Sydney, and I'm looking at my friends over here, and I also looking at someone I used to work with, like managing a very large block in Redfern. It is hard. You have to be careful about your allocations. You need to make sure people have support. But that's challenging. Not everyone wants to engage with support. So I don't think it's not an easy piece, and it's something when you are putting more and more multi-unit housing in place, you need to really think about the service delivery model. But it is a challenge also having the right resources. Just thinking about a building that I was involved in managing, 17 stories, 162 tenancies, large allocation to people who hadn't had tenancies before, and we had you need a whole range of things: on-site support, drop-in support, community engagement and development, and a careful allocation strategy. That's the challenge, and I think when you're talking about housing people with significant mental health issues, what we would hope to do is really to focus on smaller blocks rather than larger blocks. We do have, and like in our allocations, we do look at people who aren't suited to high rise. They are listed like that through the system, and so we have to think about that. But in a challenging system, these are things we're not going to get right, and that's probably the greatest rub that we have with mental health support, is that we're working with people in individual tenant but a community of tenants, whereas a mental health worker is working with one person. So you're having these arguments about, well, that's not very person-centred, and it's like, well, they live with 50 other people, and we need them to be behaving in a way that's, within a community, and that's where probably I've always found is the biggest rub with the mental health. Like you have the shared outcome of wanting to sustain a tenancy, but you have a different approach because you're working with a community, and not just the community of the people in the building, but also the community of people who live around it. And as long as we have an unfunded system in many ways, we're always going to have this challenge, and and sort of the fight between the assets team and the services team, like, that's too big, well, we need to make it work, and we're just going to keep going, right? I can see Tara laughing about that. We were just talking about what is the perfect size. The planning team recently rang me and said, what's the perfect size? I said, well, there's not one, we just have to balance it. But some of the mixed tenure can help us a little bit, but equally when I'm looking at managing, like my experience managing, or teams managing social and affordable housing together, you still have complexity in both tenancies.
Location, really, for your allocations, yeah.
I just sort of wanted to add to that point because it was along the lines of what I had, the question that I had. I'm from Housing Choices Australia, and so funding for housing is one thing, and we know that support services alongside would be amazing, and unfortunately the funding bucket's just not always there. Do you think that potentially education for community in general, like the broader community, should be part of the story? Because it's the surrounding neighbours in this, because we do high density housing as well, and not many people are used to living alongside and so closely with others, but unfortunately when you've got a footprint of land and you can house more people, that's what you want to do, because you want to be able to house the most, the greatest number of people because of the challenges that we have. So do you think that community education would be assist?
Yes, I do think that, and that is part of our homelessness strategy, not just us as a government agency, but working with our partners, all using our tools and the way that we connect in with the different partners to understand things. So there's a lot of work within our peak bodies in New South Wales to run education campaigns. So it is definitely part of it. And I think we've moved really far with our mental health workers in in New South Wales, the health department have funded housing and mental health workers who understand the housing system a lot better, and they're rolling them out. And so we can, I'm very grateful that we don't have to fund workers to go into the hospital systems. They're actually funding them themselves. So that also helps. So actually the whole service system understands how to actually connect in with each other. But yes, it's always going to be a challenge because people have very strongly held views about people and their assumptions around social housing and homelessness.
So how are you doing that? I mean, I know we've done street corners, so it's one of the things we've done in South Australia, but when you say you've done that, how? Like, what's the how piece for a neighbourhood around a property?
Oh, in just terms of a property? I mean, my personal experience with a large site is the community engagement from the beginning of the site and all the key players.
So pre-construction?
Yes, absolutely. You know, you start with the local land council and you start talking to the different neighbours, and you also keep talking to them, really. It's actually, interestingly, in the city, it is a bit easier because actually people have a greater understanding of diverse communities, and that's actually some of the stuff that's attracted to them. But we've got a long history of conversations with the community and concern around social housing. I think back to the nation building program where, politicians end up having to say, well, it's okay, we're just going to house older people, don't worry about it. But we really do have to have that as part of the development, and so that's part of the engagement. But there is a broader education, advertising campaign that I've seen. Y Foundations in New South Wales have done quite a good one recently about youth homelessness. So it's not just our role, it's also how our partners and how we go out and connect with other agencies and services. And there's actually, I guess, in the last 10 years, I've seen a lot of more philanthropic and development industry people stepping into this space as well. So I think it is connecting in more broadly as sadly because of the crisis.
I wonder if I could just add to that as well, if that's okay. Sorry, I'll be quick. I just think there's another element there as well around stigma and the need. I'm thinking two different angles. I'm thinking there's a stigma piece there, and the Commission's leading some work around an anti-stigma campaign for mental health, AOD, suicide, and also eating disorders. That was a recommendation out of an inquiry in Queensland. So we've been thinking really deeply around anti-stigma approaches and where we thought that we were going. The pitch that we were going, we realised after we tested it with the general public, we need to start way, way back further. So I think there's a stigma element there to the question that you asked. But I also think that there's a design element in there as well. And I went to the urban planning session that was before lunch in here, and I was just fascinated. We think a lot around improving mental health and wellbeing for everybody, and creating conditions where people can thrive. And I think that there's an element there of considering the mental wellbeing impacts of our designs, our urban planning, and so on. So I was just thinking, we want diverse communities, but what does that actually mean in practice? It means we have to design the systems, the spaces that set that up for success, so that people can live the kind of life that they want to live, and not rub up against all of that stigma and discrimination as well.
And I think it helps, for us at the moment in New South Wales, I think having those of us in our sphere that have the public's attention, politically and everything else, having them supporting you, like we have that in New South Wales at the moment, which is a really big key for our success, is having those, at a political level, very strong and persuasive advocates for the work that we're doing. That is really integral.
Thank you. Hi, my name's Brittany Jack. I'm from Nova for Women and Children in Newcastle, which is a SHS service delivery organisation. My question's for you, Renee Wirth. You mentioned flexible support packages a couple of times and the difference between that and a program, and I'm just wondering if you could expand on what is a flexible support package? I've not quite heard it put that way.
I guess what I would say is that we fund our specialist homelessness services traditionally, as you would know because you're one of them, to provide services to people at risk of homelessness and then targeted to crisis accommodation or transitional housing. You've got nomination rights and it's very structured around those type of housing models. But I think what we learnt from in the Together Home program, we also had support that went with the leasehold social housing that was transitioning into, long-term social housing. But how do we actually have ongoing support packages for people in social housing is probably what I'm saying, rather than just the crisis and transitional housing models. So we've had some experience where we've funded high need support packages on an individual level, but the challenge for the services is at what level can you actually hire another worker? So, and moving it away, probably the things that we're thinking about at the moment is, how do we move it away from being a program, but allocating out packages to services that they can, a person who needs long-term housing, and we'd probably say social housing, they also have the support, so we're not just talking about it being crisis and transitional. But there are some challenges because when we talk about person-centred and we look at all the different person-centred models, that's about sort of allocating a support package to a person, but the challenge of that is how do as a service then hire an extra worker. So there's those things that we need to work through with our specialist homelessness services in New South Wales about how that actually works. If we are going to move to that model, which is some programmatic funding that we have, so not the specialist homelessness funding that we currently have, but things that we've funded in blocks for 4 years, moving that into a package of support packages that can move with the person into social housing, or whether it's long-term housing, another long-term housing option they've been able to access. We have a bit of lessons to learn from the Together Home process, and certainly a lot of feedback we've been getting from services, but we do need to come out and kind of co-design that or collaborate with the sector in something that's viable.
So is that model something like NDIS, model for homelessness?
Yes, but not probably, the reality of we don't have the level of funding that is NDIS, so it will need to be tailored, and we may not be able to commit it. As we move through the stage of actually not having enough money, as we shift moving money from a program, we don't have enough money for an NDIS style ongoing package for people. We have to just work it through and continue to work with our friends in Treasury around the funding envelope. But it is about saying it's not just our supported housing models aren't just crisis and transitional. Our supported housing is also in long-term social housing. Obviously that we have a lot of people in social housing that do have support, but it's not been as a sort of a focus and as targeted coming from our our homelessness funding. They're accessing support from a range of different programs, which is great, which we'll obviously need to do, and that will be part of the role of the care coordination of a housing first package. We don't know exactly how we're going to do it. We're going to have to work with the sector because it needs to balance the person-centred with the viable package.
Can I just add to that as well? I'm just thinking in the mental health space, we have the mental health services planning framework that kind of looks at the modelling of what services, FTE, what kind of mix of services are required. And at the Commission, we've long been thinking that we need something like that in the housing and homelessness space. So that modelling that I spoke of, that we use to estimate the supportive housing need in Queensland, we're redoing that to update it to, be more modern because lots changed. But we're hoping that that might help us, or help the system to figure out exactly how much support do people need, how to quantify it, not only in terms of monetary value, but FTE, what kind of block funding might be needed, as well as individualised packages as well.
Thank you.
Hi Renee, I'm Emma, I work for NHC25. I guess I'm just coming from a curious space around, there's a number of integral, homelessness services that are currently funded outside of SHS. So I'm wondering if there's going to be additional funding through SHS services, to ensure that the people who are off sleeping or at risk of homelessness will continue to receive those supports, ongoing. Because if you're talking about the reform and, moving the funding away from that, Like, how do they continue to get that level of support?
I mean, NHC is funded in a number of different ways, but yes, I guess the answer that we see is to use our primary partners. We actually see it as the SHS. So we don't want to invent new models. We want to use with our existing service systems. So our primary partner is the specialist homelessness service system providers. So we want to move away from programs and move away into using just the one contract that we have, and top things up with the additional funding as it becomes available. So if you are funded for a particular program, it's probably not appropriate to talk about it now, but we'll be working with you to talk about how we reform that, because that program is funded until June next year. So,
thank you.
Hi, my name's Sonia Martin. I'm the founder of One Bridge, and we're a specialist homeless service, so we provide healthcare, nurses, nurse practitioners, peer support workers. For the last couple of years, and we work across Queensland, New South Wales. It's really difficult. It's really great to hear what you're saying today. It gives me a lot of hope when we talk about permanent funding models. It's something that I'm also advocating for nationally as a nurse. I suppose before my question, what we find is when we advocate from a health perspective, we go to the Department of Housing. Housing will say this is a health issue. Health will say, well, you're talking about housing. And Department of Social Services says it is, but it isn't their realm. So we keep sending the emails out. We keep speaking up. But my question is, how do we continue being part of this conversation? Because this brings a lot of hope. Currently, One Bridge has around 4 different businesses running so that we can have a regional approach, a program approach, whatever community and whatever a different housing group needs. So we try to bend and flex with what community needs, but we don't have the funding for that. So how do we continue to work with you in this space?
That's for me again. New South Wales providers.
I was going to send it to Deb.
I mean, the only thing I would say is, we do work in silos, and we have, even in the big agencies that I work in, we have to work better together. Our strategy is a 10-year strategy for a reason, because it's going to take some time to shift things. We're currently in a massive crisis in New South Wales, so we're trying to move into a stabilisation phase, but I don't have the direct answer. We know where we need to get to, but it will take us steps to do that, and we're going to continue to have services like yourself advocating for more money, and I'll continue to meet services and say, I'll manage your expectation about the funding that's available. We're never going to have all the funding that we need, but we do need to work together better, because we're working with people and supporting people that have multiple needs from across different government agencies and the not-for-profit and private sector supports that they need. So it is a challenge. We have as I said in my talk, we have a lot to do to move from where we are in a crisis emergencies response system, spending the majority of our homelessness, responses in temporary accommodation, to move to what our vision is. So, but we can't do it ourselves. We need to work with our partners around it. But it doesn't mean everyone will get a lot more money, I'm afraid. I'll just manage your expectations there. We need to target our funding and continue to invest in what works. Our view in New South Wales, it's housing and support. That is the solution. And we'll continue to advocate and drive the service system in that way.
Yeah, and my question is if there's a way that we can work together, or different groups here can link in with you and add our voice to that, because sometimes it's not about more money. It's, as we know, as you say, it's about what the region needs, what the region has in place and what the person needs. So if there's a way for us, we're here today because we have such an interest to be involved, please let us know how.
And what I hear from you there is leadership. Back to the question that we had previously, which is around how do we as leaders across a system that's really complex, how do we make sure we keep joining it up, both internal to government but also enabling our partners to see a road in for that conversation. So yeah, thank you. Just need to wait for a mic so that everyone can hear you.
Hello, my name is Violet. I'm from NT Shelter up in Aranda Country, Alice Springs. I have a question for the panel, probably most relevant to you, Renee, but happy to hear from anyone. I guess, what are some of the main themes of... this is probably most relevant to you, Renee.
Yay.
What were some of the main themes of your messaging to get government buy-in to be able to develop a whole of government housing and homelessness strategy? I ask you that because we are in the infancy on a peak body level to try and develop something similar in the future. But it would be really interesting to understand, what your key messaging was from the get-go to be able to get to where you are today.
I have to be really honest, I actually started my role in February, so I was very well done by the time I arrived. Tamsin, if you want to jump in, I think, a lot of perseverance and evidence and discussions from the policy team, but also the right window, I'd say. Like, the window opens for you. And, we do have a very engaged minister, and we also have a very significant crisis. So there is a focus there. Tamsin, what would you say?
Yeah, I'd also say we spend a lot of time talking to agencies and getting them to understand their role in homelessness as well. And I think because they're all feeling the impact in different ways. Again, as Renee said, there was just a window there because for the past 12 months everybody's been feeling it. So it was really just having conversations, say what sort of work are you doing? What sort of work are you planning? And then we help them join the dots between what that work was and how that might impact on actually making homelessness very brief, not repeated. And as it's turned out, the main focus for the other agencies, aside from homes, is really the preventative space. And that was a space that they could see quite clearly. So I think it's just, it's having the conversations, the education, it's talking to each other about what it is that you do, getting them to understand what their role is. And the benefits. You talk to them about the benefits of actually joining together. It's mutual, not just in terms of cost, but in terms of outcomes for the clients. But I'm happy to talk to you afterwards if you like.
I'm going to have to call it there because we've actually run out of time, I'm sorry. So can I please start by thanking the presenters? And thank you to everyone who has joined our session. We now have afternoon tea, and at 3:30 we're back into a plenary session back in the main hall. Thank you.